Bladder complications. Bladder complication is evolution of a particular disease, which makes it worse. Most people who have a urinary tract infection do not develop complications. Complications are more likely to occur in people who have some sort of anatomical abnormality of the urinary system or have a catheter inserted into the bladder.
People with spinal cord injury need to be aware of possible secondary complications so they can take steps to prevent them. There are two common problems that affect the urinary system of a person with spinal cord injury: urinary tract infections and urinary stones. Urinary tract infections, known as UTIs, are bacterial infections of the bladder, and in some more serious cases, the kidneys. Signs that you may have a UTI can vary. Typically, they include things like urine that is foul-smelling, cloudy with sediment, or dark with blood, pain, discomfort or autonomic dysreflexia, fever, chills or fatigue, and increased spasms. Over time, you may come to recognize patterns of symptoms that are typical for you. When you notice signs of a urinary tract infection, you should contact your healthcare team. They will help you with advice and treatment, often involving an antibiotic. Make sure you follow their advice carefully and take all your medication. If you have problems with repeated UTIs over time, this may indicate a problem with your bladder program. Urinary stones are another potential secondary complication. Signs of urinary stones include pain in the abdomen or lower back, nausea, recurring UTIs, fever and chills, and blood in the urine. Your healthcare provider can help determine whether you have urinary stones and how to treat them.
Applications in medicine. Sister said it happened because the supports of the bladder to the anterior wall of the vagina hernia through the vagina weakened. The case of sister cell is almost always with bladder brackets following a poorly attended childbirth, but also factors such as overweight, hypoglycemic, chronic constipation. Surgery provides an improvement of urinary incontinence for the vast majority of women. Two main types of surgery: urethral sling colposcopy. The surgery can be performed through an incision in the abdomen of the vagina or laparoscopically. Pros and cons. Cons: lower abdominal pain, blood in the urine, difficulty starting to urinate or an inability to empty the bladder, fluid loss, painful urination. Pelvic pain, severe bleeding, small and weak urinary stream.
Stress urinary incontinence in women. Urine is produced in the kidneys and stored in the urinary bladder. Urination is the process of emptying the bladder through the urethra that connects the urinary bladder to the external urethral orifice. There are two sphincters, or valves, that keep the urethra closed to prevent leak. Internal urethral sphincter, located at the neck of the bladder, and external urethral sphincter, located right above the external urethral orifice and is supported by the pelvic floor muscles. When the bladder is full, stretch receptors in the wall of the bladder send a signal to the spinal cord in the brain. At times when it's not appropriate to urinate, the brain sends back an inhibitory signal to keep the sphincters closed and prevent voiding. When you wish to urinate, this inhibition is removed. The spinal cord instructs the muscle of the bladder, the detrusor muscle, to contract and the sphincters to open to let the urine out. In stress incontinence, small amounts of urine leaks when the person is sneezing, coughing, laughing, or having any activity that creates abdominal pressure on the bladder. It occurs because the pelvic floor muscles are weakened and can no longer support the sphincters. In women, this typically happens as a result of pregnancy, childbirth during which these muscles are overstretched. In most cases, this condition can be treated with exercises that strengthen pelvic floor muscles.
Disease. Urinary tract infections are by far the most common complication encountered in people living with a spinal cord injury. They are most common in people who have an indwelling catheter. How can I manage my UTI? Drink more fluids like water or juice, such as cranberry, apple, or lemon juice. Make sure you and your carrot wash your hands and take care when empty your leg bath overnight, drying to prevent infections occurring or spreading.
In fact, half of all women will get a UTI at some point. UTIs occur when bacteria such as E. coli, which are usually found in your gastrointestinal tract and pelvic region, enter into your urinary system. A woman's short urethra means that bacteria don't have far to travel to infect her bladder. Typically, UTI symptoms include a burning sensation upon urination and the need to urinate frequently and urgently. Sometimes the urine can be bloody or cloudy. Symptomatic UTI usually needs a prescription antibiotic. The good news is that your doctor may be able to prescribe it over the phone if your symptoms sound like a routine UTI. You will need to see your doctor. You might need to have a urine culture taken or be evaluated for a possible infection of your kidneys. To prevent UTIs, drink several glasses of fluid each day. Staying well hydrated may flush out the bacteria before they can cause an infection. It also helps if you would urinate shortly after intercourse. Finally, take frequent bathroom breaks, even when you're busy. Holding in your urine may give bacteria a chance to make themselves at home in your body. I'm Dr. Natasha. Live well.
Bladder stones are small mineral masses that develop in the bladder, usually when the urine becomes concentrated.
This video is about bladder. Stagnant urine is often the result of not being able to completely empty your bladder. This may be due to an enlarged prostate, nerve damage, or recurrent urinary tract infections. Some people with bladder stones have no symptoms, even when their stones are large. But if a stone irritates the bladder wall or blocks the flow of urine, signs and symptoms can develop. These signs and symptoms include lower abdominal pain, in men pain or discomfort in the penis, painful urination, frequent urination, especially during the night, difficulty urinating or interruption of urine flow, blood in the urine, or cloudy or abnormally dark-colored urine. The most common conditions that cause bladder stones include prostate gland enlargement, An enlarged prostate or benign prostatic hyperplasia can cause bladder stones in men. As the prostate enlarges, it compresses the urethra and interrupts the urine flow, causing urine to remain in your bladder. Damaged nerves or neurogenic bladder. Normally, nerves carry messages from your brain to your bladder muscles, directing the bladder muscles to tighten and release. If these nerves are damaged from a stroke, spinal cord injury, or other health problems, your bladder does not empty completely. Also, a weakened bladder wall. Bladder diverticula are weakened areas in the bladder wall that bulge outward in pouches and allow urine to collect and remain stagnant. Other conditions that can cause bladder stones include inflammation. Bladder stones can develop if your bladder becomes inflamed. Urinary tract infections and radiation therapy to your pelvic area can both cause bladder inflammation. Medical devices. Sometimes catheters, which are slender tubes inserted through the urethra to help urine drain from your bladder, can cause bladder stones. So can objects that accidentally migrate to your bladder, such as contraceptive device or a stent. Mineral crystals, which later become stones, tend to form on the surface of these devices. Kidney stones. Stones that form in your kidneys are not the same as bladder stones. They develop in different ways and often for different reasons. But small kidney stones occasionally travel down the uterus into your bladder and, if not expelled, can grow into bladder stones. In developing